Symbiot Celebrating Biotech by Department of Plant Biotechnology and Department of Agricultural Extension of College of Agriculture, Velaini, Kerala Agriculture University. Before beginning the webinar, I kindly request the participants to make sure your audio is muted. There will be an interactive section at the end of the webinar. Participants can share their queries in the chat box. Participants can also listen to the webinar via our YouTube channel as live streaming. YouTube link will be shared in the chat box. Now, let's begin our webinar. Today, we have Dr. Ali Al-Sraifi, Head of Basic Science Department, Dentistry College, University of Basra, Iraq, to handle the session on magnetic nanoparticles for biomedical usage. He completed his PhD from Keele University, UK in nanopharmaceuticals and medical chemistry in 2018. He finished his MSc from Basra University, Iraq in polymer chemistry in 2000. His research interests lie in the development of a range of chemicals and nanoparticles and their translation into medical therapies, including dental applications. He has several publications in international journals. I heartily welcome Dr. Ali Al-Sraifi to Symbiot International Biotechnology Conclave. Over to you, Dr. Ali.
Thank you very much for introducing me, and thank you for the university to invite me to present my work. And thank you for Dr. Ani.
Thank you. Thank you. I think you can start the presentation. I think you can share the presentation.
So is my PowerPoint is appear on the screen?
Yeah, we can see.
Shall I start? So our lecture today will be about the magnetic nanoparticles for biomedical usage, and we will talk about the cancer and especially pancreatic cancer. So cancer is one of the biggest causes of death for humans worldwide. It is occurs due to irregular cell growth and uncontrollable cell division.
Hello,
yeah.
Dr. Ali.
Yeah.
It's not a slideshow actually.
No, my PowerPoint is not.
The slides are not moving. No.
Okay.
Now it's okay. Now slides are moving, but it's not in slideshow.
Okay. It's okay now.
No, it's actually
okay.
Now also it's in
now it's okay.
No, I think you have to share the whole window rather than the screen.
Okay. Is it okay now?
No, we can't see the presentation.
Is it okay now?
No, your presentation is not shared actually. Now it's sharing.
Okay.
Yeah. Now it's okay.
Yeah.
Right, yes. Thank you.
So as we said, cancer is one of the biggest causes of death for the humans worldwide, and it's occurred due to irregular cell growth and uncontrollable cell division. And cell growth and division, it's common, as we know, in every tissue, which is why cancer comes in many forms and can be found anywhere in the human body. Based on the literature, pancreatic cancer is classified as one of the most aggressive human malignancies with increase in incidence worldwide, and an analysis shows that the pancreatic cancer will be pancreatic cancer will be the second leading causes of cancer-related death in the United States by 2030. Also, the pancreatic cancer will be considered as the fourth most aggressive cancer in the Western world. And there is a direct link between the pancreatic cancer diagnosis and patient age, with a high occurrence of the disease happening in age around 65 to 75 years old. And the majority causes, the majority cases diagnosed at the advanced stage, making the curing for this disease unattainable and leading to high mortality between the patients. So as a result, we need an effective system to relieve these types of the problem. So nanoparticles, one of these solvents. Nanotechnology is developed of engineered device at atomic or molecules and macromolecules in the level of the nanometer range. Nanoparticles have potential application in medical field, including diagnosis and therapeutics. And also, the nanotechnology are being developed for diagnosis of cancer and infectious diseases, which can help in early detection of the disease. Advanced in nanotechnology provide us a discovery, drug delivery, and gene and protein delivery as well. Nanoparticles considered by various methodology so that effect can be targeted as a desired site. So we can deliver drug to the right cell, and here we're looking for the cancer cell. So how big are the nanomaterials? First of all, we need to understand that a nanometer is a unit of measure, just like inches or feet, meter, or miles. Nanometers is a 1 billionth of meter and used to measure things that are very, very small. It is a tiny, tiny molecules. So small mean you can't see it, something, unless you can use a powerful microscope like atomic force microscopes. Nanometers is measured, as we said, as small things. So let's say we measure the molecules of water, the size of water molecules around 1 nanometer, while typical germs around 1,000 nanometers. Also, we can measure big things, such as a hair, which is around 10,000 nanometers compared to the ball of tennis ball. It is around 68 million nanometers. So here we use nanometers as a measurement unit. Nanoparticle design will be reflected on the physical or physiochemical properties of the nanoparticles, present in their identity and influence on the synthetic group incorporated among the size, shape, surface coating, morphology, also the surface charge, solubility, and chemical composition. And these properties will also play a characteristic role in relevant mechanisms such as the cellular biocompatibility studies. The properties of the nanoparticles at the nanometers length scale materials behave differently. Why it is different? Because the increased number of atoms near the surface compared to the bulk structure. So in the bulk structure, the number of the atoms near the surface, it's less than when we compare it with the nanoparticles. That means the small particles will be the greater at the surface area to the volume ratio and higher chemical reactivity and biological activity. However, the same properties that make nanoparticles so unique, such as the small size, the large surface area, the chemical composition, solubility, etc., will be responsible for their potential hazard to human health. There are two types of approach to prepare hybrid nanoparticles. The first one called the top-down, which is referred to the successive cutting of the bulk material to gain the nanoparticles, while the other methods called the bottom-up which is the opposite of the first one. And here we created the nanoparticles by self-assembly. And the chemical synthesis is the good example for this approach. For the bottom-up approach, which is include the building up the particles by combining atom elements, this techniques widely used. This techniques widely used in local anesthesia, orthodontic treatments, diagnosis, and treatment of oral cancer. While the top-down approach, these techniques required equipment such as the sonicator. That means we need a mechanical machine to prepare the nanoscale subjects. And this type used in nanocomposite, impression materials, and bone replacement materials. All nanoparticles have been widely used, studied, and applied in the field of tumor diagnosis and treatment because of their special fundamental properties. Among these properties of the hybrid nanoparticles, the localized surface plasma resonance, radioactivity, and high X-ray absorbance coefficient are widely used in the diagnosis and treatment of tumors. The local surface plasma resonance of the gold hybrid nanoparticles, can further lead to the surface enhanced Raman spectroscopy, surface enhanced fluorescence, and photothermal conversion, also the photochemical conversion, and the polymetric responses. So these excellent qualities have been widely applied for non-invasive detection in vivo or in sight and imaging photothermal therapy. So all these can be covered by the gold nanoparticles. Here are types of the hybrid nanoparticles called, types of nanoparticles called hybrid nanoparticles, and also sometimes they call it magnetic nanoparticles. So often about this subject, because the magnetic nanoparticles have been emerged as a new front runners in the race of the treatment of cancer. And as we said, extensive studies have been carried out in order to incorporate the diagnostic and therapeutics function for this matter, forming thermostatic agents. So here we have the iron oxide and gold put together in one nanoparticles. The unique properties of these nanoparticles arise from their architecture. So the iron oxide core displays the extraordinary magnetic field or magnetic properties, while the gold surface offer the enhanced biocompatibility and facilitated the attachment of thiol group on the surface of the gold. Here, Tony and Claire, Dr. Claire, the research group leader of our group, and also Dr. Tony Curtis, both are very nice people and work with them very long time. In our group research, we prepare these hybrid nanoparticles, which is include the iron oxide nanoparticles. Then we coated this iron oxide with polyimine, PAI, followed by seeded by 2 nanometers gold seeds. After that, we returned to coated these particles by PAI again, and finally we finished the structure by gold shell. So at the end, we have these particles, which is consist of the iron oxide and gold shell. We correct these particles by the nano machine to measure the size, also by the ICP to particles. From these particles, 6 projects started to work on this particle, taking different ways. Let's start with ADI. So ADI prepare a special analog. This consists of the gemcitabine joined to the hybrid nanoparticles through a special linker. This special linker prepared by Diels-Alder reaction. The specialty of this linker, when the hybrid nanoparticles shot by laser, then the temperature will be increased, and this will lead to broken down the linker and lead the gemcitabine to release from the structure. And as you can see, he used 4 different temperature, 20, 37, 45, 70 degree, and at different time, starting from 0 to 118 minutes. As you can see, at 20 centigrades, all the compounds are stable, which is a good thing because we can save the compound at this temperature until we use it. When the temperature increased to 37, then the drug started to be released, and the highest drug release reached around 6.5. When the temperature raised to 45, we can see increase in the drug release to reach to 26 of the drug loaded to be released, while when the temperature reached 70, we can see a dramatic increase in drug release to reach around 62 or 63% of the drug. That means the system works perfectly and responds to change in temperature. After that, he studied the cell viability and to see the effect of this analog. He used 2 methods, the MTT and triband blue, to see the effect of these particles in cell viability. As you can see, the drug alone, the drug alone has perfect cell viability, while the formulation started from very high percentage to be reduced to less than 40 after reach the concentration 0.01 until 0.1 milligram per ml. And this is because the relation or the strong bond between the analog with the hybrid nanoparticles. So as we can see here, the drug uptake for the drug alone and the analog after 1, 4, and 24 hours. So the drug uptake for the drug alone, it is very small, while for the comparing with the analog, it should be very high. Uptake, it's higher with the analog, but the drug release will be slow because the strong bond between the analog and the hybrid nanoparticles. And here he compared the analog with and without heat. So he compared the hybrid nanoparticles alone, the gemstone alone, and gemstone with the linker, and finally the gemstone with linker and hybrid nanoparticles. And we can see the effect of the temperature on the hybrid nanoparticles with the gemstone, because the effect of the temperature on the hybrid nanoparticles, and this will lead to the drug to be released very fast. And he then studied on, in vivo studies to evaluation the effect of his system on the PXPC3 cell line, cancer cell line, and he compared the control with laser, and then the hybrid particles alone, and hybrid nanoparticles with laser, and the gemstone alone, gemstone with laser radiation, and hybrid nanoparticles with the gemstone. Finally, the hybrid nanoparticles with gemstone and laser. And if we compare this size of the tumor, as you can see, the tumor was reduced by using the hybrid nanoparticles with gemstone and laser, and this is again very good results for him. The second project done by Mariam used 4 different types of the bimethylamide drugs. The first one didn't consist any functional group, and she compared it with the second example, second formulation or second analog, which is consist 2 amino group, and then 4 amino groups, and then 2 amino groups and 2 silver atoms. Why she used this types of drugs? Because she liked to study the effect of the lone pair on the nitrogen and in sulfur here to make data bond with the gold shell. So she tried to upload these types of drugs on the surface of the gold using the lone pair on the nitrogen answer. And to make this formulation more stable, she used the thiolated polyethylene glycol to increase the stability of the drug on the surface of the gold, also to increase the drug loading. Her result shows that the result of drug loading for the first drug will be 0 because there is no lone pair on here structure. Therefore, this structure can make dative bond with gold shell. That's why the drug loading equals 0. While for the second formulation, we can see there is a drug loading, and this drug loading increased by using this structure when the number of nitrogen increased, and finally, this structure also can be loaded on the surface of the gold shell. Then she moved to study the drug release. So for the first compound, we can release 1, while the second example or the second compound drugs, we can see the effect of the temperature on the drug release, and also here as well for the third compound. That means both these compounds can be used as drug delivery system. Finally, the compound that consists the nitrogen and the silver atoms, we can see the release was very, very slow, because the strong bond between the silver and the gold led to make the release too slow. Therefore, she can't use this compound as well. So she reduced their study for these compounds. Then she studied the IC50 for her formulation, comparing to the gemcitabine, which is widely used as anti-cancer agent. And you can see here, she compared the compound formulation with hybrid nanoparticles and with a PEG. And as you can see, the IC50 reduced when the compound joined to the hybrid nanoparticles and when to join to the PEG. Comparing with this compound, the second compound, which is consists the 4 nitrogen atoms, as you can see here, the release will be slower than this compound. Therefore, this will affect on the IC50. And also the same thing with this compound, which is consists the nitrogen and silver. The sulfur, sorry. Therefore, the release was here too slow, and this is affected the IC50 to be higher than the first compound, which is consists just 2 nitrogen atoms. The third project done by Wajdan used a polymer called polyalylamine. And this is polymer is very soluble in water, and also it is biocompatible, so we can use it in this types of studies. The first step, she grafted this polymer with oxidizole group to first to increase the drug loading, because this is a hydrophilic polymer. Therefore, we can't loading hydrophilic drugs on it. So she grafted the oxidizole group. Also, the oxidizole group will help to make micelles when it is sonicated with the drug. Third things, we can facilitate the joint between the polymer and the hybrid nanoparticles. After that, she loaded the cytochrome, which is consists of amino acids, as consists of the thiol groups, to upload it onto the hybrid nanoparticles. Until now, the system complete. After that, she loaded the paclitaxel. As we know, the paclitaxel, it is very poor soluble agents, very poor soluble. It's around 0.3 microgram per mole, the solubility of these types of drugs. Therefore, she loaded this drug on the system to increase the solubility and then the viability of this type of drug. So she found that the encapsulation of these types of drug reach around 0.684 milligram per ml into the hydrophobic core, comparing to 0.95 milligram of the paclitaxel into the just polymer and the oxidizole nanoaggregate. So here, and with hybrid nanoparticles, and here without hybrid nanoparticles. So you can see there is an increase in solubility, and a huge increase, reach around 700 to 600 times the solubility of the paclitaxel alone, and this is a huge increase in solubility. Then she studied the effect of the systems in 4 cell lines, and she studied the drug uptake, and we can see here there is a huge increase in drug uptake comparing with a free drug here. So there is a huge increase in drug uptake. Why? Because the increase in solubility and then increase the viability of the paclitaxel when it is converted to be a nano size. Then she studied the cell viability and 4 different cell lines, as we said before. And if we compare the viability with and without the nanoparticles, we can see there is a huge increase in the viability of this drug, and when it is joined to or uploaded into the polymer and hyper nanoparticles, and this is a very, very good result. In the fourth project done by Muhannad used gemcitabine as well. Gemcitabine now joined or joined to the hyper nanoparticles through a bridge consists of the consists of the lipoic acid. So the lipoic acid substituted on the gemcitabine, and then by the lone pair on this groups, it will facilitate the attachment with the gold surface of the hyper nanoparticles. Then he studied the drug loading and the drug release and viability. So as you can see here, he compare the viability after 24 hours, 48 hours, and 74 hours. And if you remember, when we talked in the first, we said the silver make very strong bond, a data bond with the gold. This is here the same thing. So this is affect the viability of the release of gemcitabine, as we can see here with the hyper nanoparticles. After 24 hours, it's reached around 60, while here the same after 48 hours, and less than 40 after 72 hours. And this is because the strong bond between the sulfur and the gold. But the drug uptake increased dramatically when we compared with the gemcitabine alone and gemcitabine with a linker. So as you can see here, the drug uptake reached around 10.8 picogram after 24 hours, comparing with just 1065 picogram with the gemcitabine. Here, the project done by myself. So in this study, we used a type of polymer called a smart polymer. This type of polymer responds to our thermoresponsive polymer. This type of polymer responds to change in temperature to be changed from hydrophilic to be hydrophobic when the temperature increase. Then when it's changed from hydrophilic to be hydrophobic, that means our polymer will be shrink. We use this feature to prepare our system. So we use the APMA monomer, which is the N3 aminopropyl methacrylamide, and then which is this one, monomer. So we use this monomer, which is APMA, to modify the chemical structure by substituting the oxadiazole on it, by make a modification on the chemical structure. After we prepare this monomer, then we prepare a copolymer from the APMA co-HPMA, and started the drug loading, drug release of this system using 4 different drugs: the propofol, griswoldine, prednisolone, and paclitaxel. The drug loading shows very good result, while the drug release shows there is no response to change in temperature. And we spent around 6 months to solve this problem, and finally we found that the modification on the chemical structure led to change the temperature that the polymer response at. So for this reason, we introduce the PEG on the chemical structure at 10% to prepare a flow polymer. Then we studied again the drug loading and drug release. So as you can see here on the figures, we studied the drug loading for our system using the propofol and grisvolvine and prednisolone to see the ability of this system to increase the solubility of these drugs. And you can see here a huge increase in solubility by using ours. This is before introduce the PEG, and this is after introduce the PEG on the chemical structure. And in both stage, we have a high drug loading. Then we move to study the drug release of these systems or this formulation, and we can see here how our system responds to change in temperature at 5, 30, and 40, and 50 centigrade. And this is a huge increase in our system. As I said, this is get after introduce the PEG after a long work. After we improve our systems, therefore we move to the second stage to use the paclitaxel, which is the anti-cancer agents. And we uploaded the paclitaxel on the system, and then we studied the cell viability. As we can see, there is improvement in the system when it is the paclitaxel loaded on the polymer, and when the polymer heat to 40 or 50, you can see there is a release in the drug. Therefore, this led to reduce the cell viability of the cancer cells. Here we compare the drug uptake for the paclitaxel with and without using our polymer system. So at 1 hour, there is no any detectable amount of the paclitaxel for the free paclitaxel, comparing to around 3,500 picogram when we use the polymer with and without the hybrid nanoparticles. And after 4 hours, we found there's around 3,500 picogram for the paclitaxel alone, comparing to around 6,000 by using the polymer and hybrid nanoparticles. And finally, at 24 hours, the concentration or the drug uptake reached around 7,000 by using the polymer and hybrid nanoparticles, comparing with less than 6,000 or 5,500 picogram for the paclitaxel alone. Here we compare the IC50, and we can see it is around half the IC50 for the paclitaxel when we use the polymer, and less than 0.05 by using the hybrid nanoparticles and heat. And here also we compare the IC50. Sorry, this is without heat, and this is with heat. So as we can see here, there's a reduce in the IC50 by using our system. Finally, the last project done by Jinan. Jinan used again the polyallyl amine, but this time with different molecular weight. She used 4 different molecular weight of the sorry, of the allyl amine with 15,000, 17.5, and 120, 900,000 kDa, and then studied the ability of this system to improve the viability of drugs, anti-cancer drugs, by again introducing the oxidizole group on the polyallyl amine. So at first step, she studied the drug loading for the propofol and the gosvolvine. So as you can see here, there is an increase in drug loading, and that means an increase in solubility of the propofol by using the polymer. And then for the gosvolvine as well, there is an increase in solubility by using different molecular weight of the polymer. And also you can see the increase in solubility increase with the molecular weight of the polymer. After that, she moved to study the system with the doxorubicin, the DOX agents, the anti-cancer agents. She loaded the drug on the polymer, and then she studied the drug release. And as you can see here, the around 25% of the drug released after just less than 300 minutes, and around 30% of the drug released after 1,500 minutes. Then she moved to study the cell viability of the DOX, and she found that the DOX alone it's less less active comparing with the polyallyl amine oxidizole with the DOX. That means there's an improvement in the viability or the activity of the DOX when it is loaded on the polymer oxidizole system. Thank you for your attention, and if you have any question, I will be happy to answer it.
Thank you, Dr. Ali. That was indeed an informative session. Now, the webinar is open to discussion. Dr. Ali, we have certain questions from the participant side. Shall I read them out? Dr. Ali?
Yeah. I guess, yeah. I can use this on the system for MRI, and since it's consists of, yeah, sure, we can use it for MRI because, as we said, it consists of the iron oxide core, so therefore can be followed by the MRI. More advantages in dentistry than conventional treatment. Yeah, nowadays a lot of work done by researchers to use the hybrid nanoparticles in dentistry. As you know, many of the hybrid nanoparticles, such as the silver compounds, widely used as antifungal and antibacterial. Therefore, they loaded the hybrid nanoparticles on the polymer that used in prepare the denture. Also, they use it in coated the implant part to use when they implant tooth on the patient. They coated the outer layer of the implant by nanoparticles such as silver, titanium, etc., to reduce the infections and to be more acceptable by human body. Okay, the stability of the hybrid nanoparticles depend on the chemical structure of the hybrid nanoparticles. So, you know, every method prepare different type of hybrid nanoparticles. Each one has specific stability depend on the chemical structure of this nanoparticles. For our nanoparticles, it's quite stable, but we don't use it after 6 months alone. We use it freshly on the system, and therefore we keep our system for long time to see if it is stable or non-stable. But the hybrid nanoparticles alone, we use it directly. So our system is stable. Even I left it for my supervisor for maybe more than 1 year. She used it again and she found it is still very active. Sure, by using the nanoparticles, as we mentioned, many of the drugs have been used in treatment of the cancer, have been show improvement in the bioavailability and activity. Why? Because as I mentioned, many of these drugs are poor soluble in water, and therefore the bioavailability of these types of drugs and also the permeability to the cancer cells it is too low. To improve this, they use the nanoparticles. Therefore, the nanoparticles very important and shows a very good result and convert these types of drug from the bulk system to be a nano system. Okay, so nowadays a lot of work done to improve these types of nanoparticles. The main problem with these types of nanoparticles, because it consists the iron oxide, and as you know, the iron oxide is toxic to human body. That's why we coated with the polyamine and gold to reduce the toxicity of the iron oxide, and at the same time to use the properties, the magnetic properties, the iron oxide. So we need more studies to see the stability of these types of hybrid nanoparticles inside the human body, whether it is be stable or it will be degraded after time. So this is the main problem facing these types of hybrid nanoparticles nowadays.
Hello, Ali. Can you hear me?
Hi. Yeah.
Actually, it was nice presentation. So I have one question.
Yeah, go ahead.
Our group have done actual temperature sensitive drug release. So is there any possibility for pH sensitive drug release?
Say again.
Is there any possibility for pH sensitive drug release?
Drug release at which temperature?
Which pH can the drug can be
pH,
acidic?
pH responsive. Yeah. There is another type of smart polymer called pH responsive polymer, which is response to change in pH. But the mechanism of the release is quite different from the thermoresponsive. The idea based on the functional group on your system. So the functional group should be either it is basic or alkaline group. So let's say carboxylic acid or another groups. So this is the response to change in pH, and there is a quite wide range of the pH used in drug delivery systems. For example, the insulin loaded on this types of polymer, and then when the pH change as a hydrolysis of glucose, and this is led to change the pH. Therefore, the system responds to this change in pH and then release the insulin. So yeah, we can use it at different pH, but I said the mechanism is quite different from here. We use here the hybrid nanoparticles to increase the temperature when it's shot by laser, while in the pH we can't use the hybrid nanoparticles.
Thank you, Ali. Thank you.
Yeah, a pleasure.
I think we have covered all queries posted by the participants. Now, I would like to take this opportunity to thank Dr. Ali Al-Shraifi for joining us and making this webinar a success. I hope it was a productive time for all participants. I would like to express my sincere gratitude to Dr. Unikrishnan BS for connecting us with Dr. Ali Al-Shraifi. I thank all participants for their active participation. Webinar session is over.
Thank you for you all for the attendance, and thank you for the invitation again. Thank you.
It's my pleasure, Ali.
Dear participants, thank you so much for joining us for this webinar session. Our next session is from 3 p.m. to 4 p.m. Please join us at 3 p.m. IST for the next webinar session. To avail your e-certificates, submit the form given in the chat box, and we will reach out to you within a few days. Thank you so much for being a part of Symbiote. Please join us for the next session. Thank you.